My name is Marti van der Linde. I'm a community pediatric dietitian and I cover North Worcestershire. So this is a 3.5-year-old boy with the George syndrome. He's got oral hypersensitivity and sensory feeding issues. He had a mid-gut malrotation, which they corrected at 1 year old. And his foster mom has felt that this operation has always had an influence on him having poor tolerance of feeds. He had the gastrostomy inserted at 2 years old. Continues to suffer with poor gut motility, resulting in constipation. He's got severe developmental delay and was 32 weeks, born at 32 weeks, so premature. He had cardiac surgery to correct some of his congenital abnormalities. He was previously on a 1.5 calorie per mil feed, but was gaining too much weight. So we didn't want to go to a 1 calorie per mil feed. And he was starting to become more active. So it was getting a fine balance with getting a middle ground feed that didn't cut his calories too much. And he continued on and off to still have reflux problems and constipation. I wanted to try isosource with this child because it was a middle step coming down from being on a full calorie feed, and his carer was really keen on introducing blended diet, but was very nervous about it. And I know that the isosource is very well tolerated, so would have helped the child with the reflux that they were still suffering from and the occasional constipation that they had. So because Isosource has the blended diet recipes as well, I knew that it would be an easy step for the carer to start to introduce some blended diet as well. So it just seemed the ideal feed to try with this child. I was hoping to reduce the esophageal reflux and also to reduce the amount of constipation he was having. But equally, I wanted to support the carer to start introducing the blended diet because she was very keen that he has some of the family foods at meal times. But in the school setting, the child would not be able to have the blended diet and would need a background feed. And because it has food derived ingredients, it seemed to fit well with the thinking around a blended diet and taking part in meals as opposed to a prescribed feed. So the carer was very cautious about introducing the new feed because of the severe reflux that the child previously had. Even though she was completely on board with the idea of the feed and agreed in principle, we started by replacing one of his bolus feeds in the day. And then once he was completely stable on that, she wanted to do about 3 days before she'd consider introducing the second bolus. So we've gradually switched him over by introducing the boluses one by one until he was completely switched over. One of the first comments that she made was that he looked more relaxed while he was being fed, and also he has no need for laxatives at the moment. His laxatives, he was having laxatives once or twice a week. That's completely stopped, and there's been absolutely no reflux since he's been switched over. So the carers, he's in foster care. The carers have felt that the child is different and he's more relaxed. And they also really appreciated the fact that he no longer did this gagging, retching motion that he was normally doing when he was being fed. And they really noticed the difference in his mood. And they've said to me that they felt his energy levels are really good because there was some concern with dropping down the energy level in the feed from a 1.5 calorie to a 1.2 mil, 2 calorie per mil. They were worried that the child will have less energy and be lethargic, but his energy levels remained good. I would really recommend the isosource for patients because in this child's case, it's really allowed him to now have less reflux, and this constant gagging reflex that he was having has completely disappeared. So he's in a happier, healthier place. His bowels are regulated, no longer needs laxatives. And the foster carer feels comfortable now trying to start to introduce the blended diet alongside isosource because of the isosource recipes that has really encouraged them to try using the blended diet to move on to. And I think for this child, he'll now be able to be part of the family, in taking part in the family meals through the blended diet, but then have the background feed of the isosource in situations like school or formal settings where the blended diet can't be used.